Hi, I'm Bailey, and I'm going to be doing a postpartum assessment on a mother that had a baby about 24 hours ago. When I walk into the room, I'm going to do hand washing and perform good hand hygiene. My name is Bailey Sturry. I am a nursing student from the University of St. Francis. Can you please tell me your name and date of birth?
Chandra, 4676.
I'm also going to check her ID band just to make sure that her band matches what she just told me and matches the computer so I have the right patient. I am going to be doing a postpartum assessment on you. You had a baby about 24 hours ago, correct?
Yes.
Awesome. The first thing that I want to complete is your vital signs, so I'm going to start by taking your temperature. What I'm doing is I'm looking for a range of 97.6 to 100.6, and she's at 98.6. The next thing that I'm going to do is I'm going to feel for your pulse here on your wrist. I am looking for 50 to 90. I'm going to check it for 30 seconds, and I want to also feel for the amplitude and a good rhythm. She does have a good rhythm. It's bounding, and her pulse was about 75 beats per minute. The next thing that I want to do is I want to assess her blood pressure. But while I'm doing this, so the patient doesn't alter their breathing, I am going to count her respirations while I pretend to hook her up to the blood pressure monitor. So I'm going to count for a full minute to get her respirations, and those are going to be 16 to 24 respirations per minute. And we're going to say that she had 20, so her vitals are going really well. The next thing I'm going to do is check her blood pressure, and the ranges that I want to look for that is 140 over 100 to 90 over 60. Okay, so the next thing that I want to do is I want to listen to your breath sounds, and this is still part of our vitals. And I also want to ask you, do you have any pain?
No.
Okay, good. I'm going to listen to your breath sounds. Can you breathe deep? Go ahead and let out. Again. Good. What I'm looking for is any crackles, wheezing, anything of that nature, and I want to make sure that her lungs sound clear and equal. The next thing I want to do is I'm going to explain the bubble H process, and it's actually bubble he, but we leave out the E's. Okay, so for your purposes, I'm going to be doing an assessment that I refer to as the bubble H. I will go through the acronym with you as we go. The first thing I want to do is feel your breast for any tenderness, warmth, any redness, make sure that your nipples are intact and all of those things. So what I'm going to do is palpate in a circular motion with the flats of my hands. Are you feeling any tenderness when I do this?
No.
Good. And I also want to check and make sure that your nipples are intact, and they are. There's no bleeding, and they're not chapped. Are you breastfeeding?
No.
Okay, good. Or not good, but that's normal then, for them to stay healthy. The next thing of the bubble he, we're going to do uterus. So what I'm going to do is feel the top of your uterus is called the fundus, and that is actually all the way up here usually. It's right here. So what I'm going to do is, that's your belly button, right? Mm-hmm. Okay, so it's about 1 finger breadth above your belly button right now, and that'll go down about 1 centimeter per day. What you want to do is take your hand, and this is a teaching moment. I want you to massage this 1 minute every hour in circular motions to help that fundus go back down. And the other part that I want to tell you while we're here, I want to make sure that your fundus is positioned in the middle of your stomach still, so the uterus isn't off base. I want to make sure that it's not super hard, but it's there and palpable. If your bladder can get to a point where it starts to grow and grow and grow, and our body forgets to tell our mind that we have to go to the restroom. So one good thing to do is go to the restroom every 2 hours without thinking about it, just because that could alter the placement of your fundus, and that will make it harder for it to go back down to normal size. The next thing that I want to do is I want to check your bowel sounds. And when's the last time you had a bowel movement?
Yesterday.
Okay. I'm going to check in all 4 quadrants, and I want to listen for a good long time to where I hear something and I can determine if your bowels are hypoactive, active, or hyperactive. And I can listen for up to 5 minutes if I'm not hearing anything. The next thing that I want to do is go to bladder. But are you passing any gas? Have you been passing gas?
No.
Okay. I might have to talk to your physician about that. The next thing I want to do is talk to you about your bladder. I told you that you need to go to the restroom every 2 hours. When is the last time you voided?
About an hour ago.
Okay. It's like I said, it's important to go every 2 hours. Are you having any difficulty urinating?
No.
Okay. And do you have any signs or symptoms of a UTI?
No.
Perfect. The next thing that I would like to talk to you about is your lochia. It's a fancy term for bleeding. So I just want to check your pad. I have one here. It's obviously a lot bigger in person. But what we want to do is we want to look at this off of a 1 hour basis. So when is the last time you changed your pad? Or a nurse changed it?
About an hour ago.
About an hour ago. Okay, so we have about 3 inches of blood with about 1 inch thick. And we will call that light to moderate bleeding. There's nothing to worry about. It's rubra, so rubra is red. That's good and normal for right now. And I also want to look for or smell for any foul odor, and I don't want to let the patient know if there is one, but that could be indicative of an infection. And I also want to see about any blood clots, and just make sure that it's not too much. And one other teaching point that I would like to point out to you is that if you're at home and your blood starts to go to the pinkish brown stage, which is good, and then it'll get to like a colorless discharge, if it goes back to red, you need to go back to bed. It means you're being too active, trying to be super mom, and that's not what we want, because it just prolongs your healing process. And I forgot to say, but I would put gloves on when checking your pad. Next thing that I want to do is check your episiotomy. So you can just roll over that way for me. So what I'm going to do is I'm just going to check the episiotomy for Rita. So what I'm looking for is redness, edema, ecchymosis, discharge, and I want to make sure those suture lines that the physician put in are still approximated. The other thing that I want to check for is her epidural site. Make sure that that's still closing up, healing well, no fancy discharge there. Make sure that that's intact. And I also want to make sure there's no hemorrhoids beginning and starting here. Okay, you can lay back now. I also would like to feel your calves to make sure you don't have any blood clots. That's common after birth. So I'm just going to feel and make sure, do you have any pain when I touch?
No.
No? Okay, you don't have any swelling or redness, so that's really good. That generally means that we don't have to worry about a blood clot, but we'll keep monitoring that too when you're here. So one thing that I won't mention to the patient is my last 2 E's. I educated through my entire process with 4 points. But I also want to monitor her emotions. I want to make sure that she's not feeling depressed or super sad. She does act like she's tired, but she seems to be happy about her new baby, and that's very good. So before I'm finished, I need to check any IVs, a Foley if it's still in, and I want to do a cesarean inspection just in case. So can I see your IV here? Okay, it looks good. And I would also test this with Rita. Redness, edema, ecchymosis, discharge, and make sure that everything is still approximated. So that's good. And she got her Foley taken out following birth, so that's completely fine. Okay, so here is where her cesarean suture would be if she had one. And she did not. But what I would do is also check that for Rita. She doesn't have any redness, no edema, no ecchymosis, no extra discharge, and her suture lines are still approximated. So that is my assessment. Thank you for watching.